Hello. Today's lecture would be Chapter 23, Cancer Development, and Chapter 24, which is Care of the Patients with Cancer. So we'll start with Chapter 23, Cancer Development. Um, the learning outcomes for the lecture today would be safe and effective care environment, which would be to help people identify behaviors that reduce the risk for cancer development and cancer death, and teach the recommended screening practices and schedules for specific cancer types. For physiologic integrity, we're going to explain what causes specific cancers, um, use knowledge of basic biology to understand how normal cells can become malignant, distinguish the features of normal cells from those of benign tumors and cancer cells, discuss the roles of oncogenes and suppressor genes in cancer development. We're going to compare the cancer development process of initiation and promotion. Um, and we're going to interpret cancer grading. We're going to explain how cancer metastasis occurs and the common sites of distant metastasis. And we're going to discuss the role of immunity and protection against cancer. We're also going to assess the individual patient's needs for genetic testing for cancer predisposition based on family history. Okay, first we're going to discuss um, cell growth. When you're talking about cell growth, we're going to discuss first what a person has, which is basically they have what they call their original tissue. Then they have increase in tissue size, which is known as hypertrophy of the tissue, and then you have increase in tissue size, which by what they call hyperplasia. But before we go into detail about that, um, what we're going to discuss is what the most common types of altered cell growth, um, which are like things as such as moles or skin tags, and most of those are what they call benign. And benign are they're harmless and they do not require any intervention. Malignant cell growth or cancer, however, is serious and without intervention, it can lead to death. And cancer is a common health problem or newly diagnosed with cancer. Usually there's about 1.5 million people a year. Um, Although cancer is common today, it is not a new disorder, and some types of cancer are more common today, especially among more affluent societies than in centuries past. And it may be because they're just really looking at cancer and discovering cancers. Um, so what we're talking about here, as you can see, is cell growth and cancer growth. Um, First of all, when you talk about the pathophysiology of cancer, you want to discuss what they call mitosis, which is simple cell division. And such cells, they're located in tissues in which constant damage or wear is likely, and continued cell growth is needed to replace dead tissues in our cells. So you talk about cells such as skin, hair, mucous membranes, bone marrow, and linings of organs such as the lungs, stomach, intestines, bladder, and uterus, among others, have the ability to divide throughout a person's lifespan. Okay, so that's how we're looking at it when we talk about, like cell growth. And so right there, they're showing you like a picture of an original tissue, and you can see how that looks. That picture is also figure 23-1 in your text, page 397. Then you're going to look at the cell tissue, which is increasing tissue size by hypertrophy. And hypertrophy is growth that causes tissue to increase in size by increasing the number of cells. The actual number of cells is hyperplasia. So you can see on your picture how there are more cells that is keep making your tissues, grow in size. Any new or continued cell growth not needed for normal development or replacement of dead and damaged tissue is called neoplasia. So I want you to know the difference between hypertrophy, hyperplasia, and neoplasia. These cells in neoplasia, for instance, they grow is always abnormal, even if it causes no harm. So, whether the new cells are benign or cancerous or neoplastic cells develop from normal cells, this thus cancer cells were once normal cells, but they changed to no longer look, grow, or function normally. And that is the reason why a lot of times what happens is that individuals will say if you see something on somebody, we want to get rid of that right away because you don't want to you don't want to keep something that could potentially grow into a cancer cell. So biology wise, there are certain features of what they consider a normal cell. um, First of all, a normal cell has limited cell division. So there's not a whole lot going on as far as the biology of a normal cell. Also, a normal cell has what they call apoptosis. So they have limited cell division and they have apoptosis, which means they're not doing a whole lot of like dividing. They're just kind of right where they are. There's no lot of things going on. So when a person has apoptosis, usually what that means is that sooner or later that cell is going to die off. um, as far as normal cell growth, also they have what they call a specific morphology. So, limited cell division, which means little to no cell division. They have apoptosis, which means that they are going to die off after a while. And then they have specific morphology. By specific morphology, that means the feature in which each normal cell type has a distinct and recognizable appearance, size, and shape. So, there's a specific morphology. There's a specific way that that particular cell looks. Also, they have a small nuclear to cytoplasmic ratio. So that means that the nucleus of a normal cell does not take up a whole much space inside the cell, as shown like if you look at figure 23-2. The size of the normal cell nucleus is small compared with the size of the rest of the cell, including the cytoplasm. So, like if you look at figure 23-1, they have the little cells in there, and you can see where, like, they got the G1, G2, S, and then all the rest of that stuff surrounding is what the cytoplasm is. So they have a small nuclear to cytoplasmic ratio. So there's a small cell and a whole lot of cytoplasm. Their specific morphology, they're gonna die off, which is apoptosis, and they have limited cell division. Then they have a differentiated function. What that means when they say differentiated function, it means that every normal cell has at least one special function it performs um, when you think about how it contributes to the whole body. So, for example, a skin cell makes keratin. Liver cells make biles. Cardiac muscle cells contract nerve cells and conduct impulses. And red blood cells make hemoglobin. So, Feature of normal cells, their limited cell division, apoptosis, which is the death or timely death of a cell, a specific morphology, a specific way that they look, a specific way that they size that they are, small nuclear to cytoplasmic ratio. They have a differentiated function, which means that they're different from everything else. Each cell that belongs to specific organ or whatever it is, that specific cell has a specific function. They have tight adherence. By tight adherence, what that means is that a normal cell um, make proteins that protrude from the membranes, and it allows cells to bind closely and tightly together. So one such protein, for instance, fibronectin, um, which keeps most normal tissues bound together to each other. Exceptions are blood cells. Red blood cells and white blood cells, they don't produce that fibronectin, and they do not usually adhere together. But most of them do adhere together. So they have tight adherence. And they're non migratory, which means that they're not all over this place. Now, if you want to put that into perspective, you can think about it in terms of when a person has a cancer cell. There are occasions when you have what they call, when they talk about in terms of cancer cells metastasizing. So basically what they're saying is that if you have a normal cell, it's non-migratory, which means that it's not going to go from one area to the other. It's going to stay in the cell, it's going to stay in whatever particular body function or organ or wherever it's supposed to be. And then it has what they call contact inhibition. So basically, and it also has normal chromosomes. So none of these things that you may see like as features of cancer cells. So what I wanted you to do was make sure that you memorize the features of normal cells as opposed to cancer cells. So a limited cell division, apoptosis, specific morphology, small nuclear to cytoplasmic ratio, differentiated function, tight adherence, non-migratory, contact inhibition, and normal chromosomes. So these are the characteristics of normal cells. Next, features of early embryonic cells. When you talk about early embryonic cells, they have rapid and continuous cell function. They have anaplasia. They have large nuclear to cytoplasmic ratio. Plural potency, so they can be potent and do things um, in various different areas. They have loose adherence. They have migration. They have no contact inhibition, and they have normal chromosomes. So you need to be able to differentiate the difference between these types of features of the cells. So the first one was the biology of the normal, and then the other ones was the early embryonic cells, which basically that's kind of like right before they start to turn, you know. Um, Features of benign tumor cells. Okay, benign tumor cells are cells which are normal, but they're growing in the wrong place, like at the wrong time, for instance. You know, there's been times when a person may see a little cyst or something on them, and they know that it's abnormal. They know that it's something other than what it should be, and basically, you know, you go get it snipped off, and then they look at the little cell, and it is considered a tumor because a tumor is simply a growth. and then it's not nothing that's gonna really cause no whole lot of harm. So the features of a benign or tumor cell, which is considered an abnormal cell because um, it has a continuous or inappropriate cell growth. That's one of the features that makes it uh, what they consider inappropriate or what they consider abnormal. It has a specific morphology, just like the other ones. It has small nuclear to cytoplasmic ratio, specific differentiated functions, tight adherence, no migration, orderly growth, and normal chromosomes. So those are the features of a benign tumor cell, and it's almost somewhat just like what one would call um, a normal cell. Features of a cancer cell. So be able to distinguish the difference between it has rapid or continuous cell growth or division. Unlike the other, it has anaplasia. It has large nuclear to cytoplasmic ratio. So that's the difference right there. So the nucleus of a malignant cancer cell has a big nucleus and less cytoplasm. Specific functions are no longer there; they're lost. Loose adherence, so that means that's giving it the if it has loose adherence, that means that the cancer cell can go from this organ or this tissue to another tissue. It migrates, like I said, no contact inhibition. So if it comes into contact with something, it's not going to be inhibited. It's still going to keep doing what it's doing. And then it has abnormal chromosomes. Okay. Now, terminology, you guys. One terminology is metastasis. Um, I'm sorry, metastasis. Metastasis simply is a progression of various steps when you talk about cancer. This is the ability for to spread. Uh, it's unique to cancer cells, particularly, and the metastasis is basically one of the biggest causes of why people die. A lot of times people don't die um, because of, oh, I got cancer or this one little thing or whatever. A lot of times people die because they had one type of cancer and then it moved to another part as well. So, some of the characteristics of metastasis is extension into surrounding tissues, blood vessel penetration, release of tumor cells, invasion, local seeding, bloodborne metastasis, and lymphatic spread. So those are like the um, characteristics of metastasis. So, um, right here where we're discussing steps of metastasis, you can see right here where it has normal cuboidal epithelium in the blood vessel, and it's kind of just showing you pictures of what's going on when a cell metastasizes. If you want to look into at the book on page figure 23 to 5, it has the steps of metastasis, and it's basically telling you that it's going through those particular steps. And um, what happens is that you got what they call neoplastic cells, and they originate from normal cells. And when they have that malignant transformation, which is basically one of the first steps, some of those normal cells in that tissue undergoes that transformation, and they start like dividing. So then when that happens, it goes into the cancer cells secrete tumor angiogenesis, TAF, and it stimulates the blood vessels. And so then they bud and they form new channels, and then they grow into tumors. Then the blood vessels penetrate, and then they break off into like enzymes on the surface of the tumor cells, and they're allowing the cancer cells to enter into the blood vessels and travel around the body. And then the cancer cells clump up in the blood vessel walls and invade the tissue areas. And if the right condition supports continued growth of the cancer cells, then you have what you call met, metastatic. I'm sorry, metastatic tumors, more or less. So tumors and stuff that spread from one area to another. Okay. Okay. So we know already that you have that type of thing going on, and so what I wanted you to do is you have what they call cancer prevention, and basically cancer prevention is avoidance of known or potential carcinogens. So basically what you're going to do is you're going to do the type of behaviors and stuff that you know that would help you not develop cancers. So one of the big things, of course, that you hear people talk about is that all these various things that you do, like not smoking and various behaviors like that. So I do want you to know that they do have different types of cancers, and they have common sites of cancers. They have breast cancers, and if you look at table 23.3, they have different areas where particular types of cancers, let's say, they originate in a certain area, and then they metastasize to various areas as a result. So you got like breast cancer, and then you have bone, lung, liver, and brain. That's where a lot of times you will see um, that type of cancer that originates spread to lung cancer, brain, bone, liver, lymph nodes, and pancreas. And it just goes on and on like that. So they have ways, and the cancer that first starts, like if it starts in the breast and then it goes to another area, like to the lung or whatever, the primary tumor was originated in the breast. So that's how they started. And what they do normally, they have what they call staging. And when they do staging, that's like a form of grading of a tumor, and it classifies like cellular aspects of the cancer. And then they have what they call ploidy, which is PLOIDY, and it classifies tumor chromosomes as normal or abnormal. And then they have what they call staging, and then that classifies like clinical aspects of like the tumor. So you can see where they have the grading of malignant tumors, and then they'll have like GX, which is grade cannot be determined, G warm one, which is tumor cells are well differentiated and closely resemble the normal cells. And then each thing like tells you where, and how they're grading. So if you look in your book, and then like for instance, let's say you look at table 23.5 and table 23.6, those on page 402 to 403. They even have the tumors, the staging of the cancer. like as a primary tumor, a regional lymph node, and distant metastasis, how they would like grade, particular tumors, and you may want to know um, that or be able to, like for instance, if they say that a person has a G1 and uh, I don't know, N X or something like that, you'll kind of know, or you'll kind of know, whether or not it metastasized, whether or not it's where it's supposed to be. Cancer prevention, of course, you're going to have what they call regular uh, screenings, like people who go and they screen for breast cancer and that type of thing. um, they have altered or damaged genes or genetic screening. And a lot of times when you do the prevention, oh, I'm sorry, let me go back. I wanted to tell you as far as cancer prevention, primary, and I didn't tell you about the avoidance of known or potential carcinogens. I had got on talking about things like smoking. Um, there are certain tissues that's associated with tobacco use, like tissues with the greatest risk for tobacco induced cancer are those that have direct contact with tobacco or tobacco smoke. So, therefore, you're going to have your lung and your oral cavity and that type of thing, like that. um Cancers associated with a viral origin is things like Epstein-Barr, hepatitis B and C, and a lot of people have heard about like the HPVs and that type of thing. So that's how you need to, as far as decreasing your risk of cancer, a lot of times they'll tell you patient and family education. You need to prepare for self management. You want to avoid excessive intake of animal fat, avoid nitrates, minimize your intake of red meat. You want to keep your alcohol consumption to no more than 1 or 2 drinks per day. You want to eat bran and veggies, and they say foods with vitamin A, or like fresh veggies and that type of thing. Also, they said that there is a genetic link to various cancers. So some things are things that there's really nothing that a person can do as far as the development of cancer. So personal factors, which include like what immune function, age, and genetic risk, affect whether a person is likely to develop cancer. So, um, a person advancing in age is probably the most important risk factor for cancer, because as a person ages, their immune uh, um protection decreases and external exposures to carcinogens accumulate, so you've been around longer. Um, so older people need to be uh, known, and they need to know that they're at a greater risk, and so they need to make sure that they watch and get screened. And just because like a person is at risk or something or whatever, that doesn't uh, mean necessarily that that a person, if they get a cancer or whatever, that's gonna take them out or whatever like that. But what it means is that you just be aware and you get yourself screened, because if just because somebody has cancer, that doesn't mean that that's like a death sentence. A lot of times, what happens is it's when they catch the cancer nowadays. So it's like really important that you do regular screening and you watch for assessing certain areas. Um, they have what they call the seven warning signs of cancer, and what it does is it basically um, describes the word caution. And so when you're performing an assessment for cancer, what you want to do is you want to assess these particular areas. And caution, which would store for, like if a person has changes in bowel or bladder habits, like if they're starting not to urinate more, or if they're starting to have diarrhea, and this was something that wasn't going on. A in caution means that a person has something like a sore that does not heal. U, if they have any type of unusual bleeding or discharge. Or T, which stands for thickening or lump in the breast or elsewhere, indigestion or difficulty swallowing. And O is an obvious change in the wart or mole, and then N is a nagging cough or hoarseness. So, like if you could use the word caution to help you know what type of things to screen for, a lot of time that'll be a good thing to do. Okay. Chapter 24 is care of patients, particularly with cancer. Um, we're going to start this lecture off talking about general disease related consequences of cancer. Impaired immune and blood producing function, altered GI structure and function, motor and sensory deficits, and decreased respiratory function are some of the main things. Um, Cancer can develop in any organ or tissue, and it definitely destroys the normal tissue that's around. So, cancers that are left untreated often cause reduced immunity and blood producing functions, altered GI structure, as I said, motor and sensory deficits, and decreased respiratory function. Impaired immune and blood producing functions occur most often in patients when they have like disease processes such as leukemia and lymphoma, but they also can occur with any cancer that invades the bone marrow. Tumor cells enter the bone marrow and reduce the production of what they consider healthy white blood cells, which are needed for normal immune function. This patient who have cancer, especially leukemia, are at an increased risk for infection. When cancer invades the bone marrow, it also causes anemia by decreasing the number of red blood cells. Okay, so when you have more white blood cells, it'll automatically decrease the number of red blood cells, and that's when you'll hear them talk about patient that has thrombocytopenia or that type of thing like that. Also, to express more about the altered GI structure and function, cancer can alter GI function and impair nutrition. Abdominal tumors may obstruct or compress structures anywhere in the GI tract. Um, a lot of times, people who do have cancer have anorexia that often interferes with their ability to meet energy needs. Cachexia, which is extreme body wasting and malnutrition, develops from an imbalance between food intake and energy use. Okay, so nutritional support for the patient with the cancer, especially one undergoing some type of cancer therapy, it may really be complex, and a lot of times they have to do what they can do on an individual basis. Uh, Then people sometimes may have motor and sensory deficits occur when cancers invade bone or the brain or compress nerves. If a patient with bone metastasis um, related to some type of primary cancer. The bone sites most often affected, like for instance, if they had a lung or a prostate or a breast, the bone sites most often affected are the vertebrae, ribs, pelvis, humerus, clavicle, that type of area. Patients who have sensory changes, if the spinal cord is damaged, a lot of times, or the nerves are compressed, sensory, motor, and cognitive functions are impaired. So they mean that once you start messing with the nerves and you have tumors or growths and stuff on the brain or whatever, and the tissue is destroyed, a lot of times that'll impair a person's ability to speak, act, or do the functions that they need to do. Lastly, with as far as reduced oxygenation, we've seen plenty people who have all types of lung cancers and different tumors, which get in the way of their airways and might cause some type of airway obstruction. Tumors can often thicken the alveolar membrane, and it can also damage pulmonary blood vessels, reducing the gas exchange. And I know a lot of times you guys will see that as far as when you see people who might even have trachs and that type of thing. So, just want you to know that there are like those main ways that cancers or diseases, related cancers, can cause changes in how in your body is through the blood, through the GI, through motor and sensory, and lastly through respiratory. So every pretty much main function. Surgery. Basically, a lot of times when you have people and you're trying to manage their cancer, to prolong, survival and their quality of life, people can have surgery, radiation, chemo, hormonal, photodynamic therapy. They have all types of different therapies nowadays that they use to treat cancer. So, if upon doing this, they use various modes and various ways to do things for to treat a patient. The first one is what they call prophylaxis. Um, Prophylactic surgery basically removes at risk tissue to prevent cancer development. It is performed when a patient has either existing premalignant condition or a family history. Prophylaxis, so basically, when you do something prophylactically, you're doing it to prevent the bad things that could possibly happen from happening. Um, to give you a perfect example, Angelina Jolie, she had a double mastectomy. That was like a prophylactic surgery because she looked and she saw that she had the gene for breast cancer. And then apparently, I'm thinking they said that her mother or someone had died from breast cancer. So she did it on a prophylactic way. Then they have what they call diagnostic surgery. As far as, and that's when you go in and you get a biopsy or you remove a lesion or something like that. Curative surgery removes all the cancer tissue. Surgery alone can result in a cure rate of 27 to 30% when you've gotten all the tissue. Uh, Cancer control or cytoreductive surgery removes part of but not the entire tumor. It is also known as debulking surgery and alone cannot result in a cure, so the control. Palliation surgery focuses on improving the quality of life. So it ain't even about cure at that point. It could be like something could be interfering with another bodily function, and they move it just palliatively so that that person can gain functioning in the area. Maybe they got a tumor and they can't swallow, so they might remove the tumor so that the person could swallow, but that doesn't necessarily mean that they moved all the cancer. Second look surgery is a rediagnosis after the treatment. So whatever they've done beforehand, then they go back in for a second look, and then reconstructive and or rehabilitative, and that's like, for instance, when they remove a breast, and or they do a bowel reconstruction, or they revise scars, or something like that as a result of a person having some type of cancer surgery. Okay, we'll talk about radiation therapy. Radiation therapy purpose of radiation therapy for cancer is to destroy cancer cells, and basically what you do is you have minimal damaging effects on the surrounding normal cells. So basically, they're trying to just shoot these radiation beam to. It's more like a local area. It's just that area that presents with the uh, bad cells. Um, most of the radiation therapy for cancer is ionizing radiation when cells are exposed to it, particles within the cell's nucleus or rearrange. And a lot of times, the cell damages by radiation die outright or become unable to divide as a result of them shooting them with the radiation dose, and it just kind of depends on how much radiation and what have. They also use it, I mean, as a result, they'll use radiation along with uh, other types of therapy as well. Side effects of radiation, I mean, it varies according to the site. Local skin changes, like for instance, because they're going to one area, is hair loss that will result. Okay, I'm sorry for that interruption. Um, anyway, going back, the side effects of radiation therapy may vary according to the site. Local skin changes would be hair loss that will likely be permanent depending on the total absorbed dose, altered taste sensations, fatigue related to increased energy demands, and inflammatory responses that cause tissue fibrosis and scarring. I have witnessed that before. Actually, my own mom had radiation after they had found a cancerous lump, and she had like a lumpectomy done, and so then they hit her with the radiation afterwards. And I'm gonna tell you, her breast, that area where they was doing the radiation, was hard as a rock. It was just like somebody had took something and, I mean, like you could almost like knock on it like it was hard. And then with time, after the therapy was complete, it actually started to peel away, you know. So it can um, do things as far as like to the local area initially, and can be a problem. So that's, what it is. Um, basically, when you're doing patients and they're undergoing radiation therapy, some of the important things you want to note as a nurse is to teach accurate, objective facts to help patient cope. So you're going to tell them everything that they need to know, as far as things the patient really needs to know. Teach patient about their skin care needs during radiation. You want to make sure you don't remove the markings that the doctor will put on them when cleaning the skin until the entire course of radiation therapy is completed. So they want to avoid using lotions or other skincare products within 4 hours of the radiation therapy because they say that can make them burn. So teach the patients to follow the radiation oncology department's policy regarding the use of certain various skin care products, um, and stuff like that. Avoid direct exposure of the skin to the sun, and then also, especially depending on what type of radiation the person is getting, um, you want to give them care for xerostomia, which is basically like a dry mouth, which increases the patient's lifelong risk for tooth decay. So and teach about the symptoms that might be expected from the location and whatever dose the person may be getting it, and that'll just like really vary depending on the individual. Bone exposed to radiation more, it's also more vulnerable to fracture, believe it or not. And you got to look at it in terms of what that you're killing um, really good skin for a while, but after a while it does regenerate depending on what it is. Chemotherapy is another treatment for cancer. Chemotherapy treating cancer with chemical agents. The major role in cancer therapy is used to cure and increase survival time. Some selectivity for killing cancer cells over the normal cells, and normal cell most affected would be like the skin, hair, intestines, spermatocytes, and blood forming cells. So basically, what they're saying is that when a person has chemotherapy, the way they develop certain types of drugs for chemotherapy, they're specific to certain types of cells. They will affect the skin, the hair, the intestines. People have been known to be like they say the spermatocytes, like if they were on chemo, maybe it may affect a person's ability to reproduce. On your book on page 415, they have various types of drugs that they use, and what type of drugs they are, whether or not they're a vesicant or irritant. They have, what type of tissue damage potential that the various drugs have. I don't really know a whole lot of them, but the anti metabolites, I do know about them. Um, some of the names, if you want to just look over them. If I want you to know any of them, I'll make sure that I do so and let you know what to do when it comes time for the testing. And then I do know like some of the antimitotics and stuff. I like vincristine and that type, and they're really like vesicants and that type of thing. So they interfere with like DNA, like cell division. So depending on what type of chemotherapy agent you might consider using. So. As you can see, as far as treatment issues are concerned, you got to know and make sure that the amount that you give and the schedule and the administration is like, it's real kind of like where the doctor will pick what they think is done, or how aggressively they may think that you may be able to tolerate it, or it may be needed. um, um, Extra versation means that, like for instance, if a person, it occurs when the drug leaks into the surrounding tissues. It's kind of like almost like a infiltration of an IV, and when the drugs are get or what they call vesicants that they're given, like some on the chart that I told you to look at in your book. What they can do is they can damage really good tissue and really mess a person up. And so some of them are really, really, really irritating uh, to the body, and that's the reason why I told you guys that a lot of times you'll see people having like mediports and that type of thing when they're getting continuous chemotherapy because of the fact of, I mean, the IV therapy, they have recognized over time that that is just like really probably a horrible experience for a person to achieve, to have a IV, because a lot of those chemotherapy agents would tear a vein up. Um, Most chemotherapy drugs, even oral drugs, are absorbed through the skin and mucous membranes. So, even if they like a low dose, a long term exposure to chemotherapy drugs can affect, your health. And within 48 hours of receiving IV chemotherapy, they must use extreme caution, and you need to wear equipment includes eye protection masks, gloves, and that type of thing. And that's like a OSHA requirement because of how damaging the medicines can be. Side effects of chemotherapy are so many. We could say anemia, neutropenia, and thrombocytopenia. Anemia, you guys, is decreased number of red blood cells and hemoglobin. Neutropenia is decreased number of white blood cells, which lead to you to be immunosuppressed because of the fact that you don't have the white blood cells to fight. And then thrombocytopenia is decreased number of platelets. So I would like for you guys to know that usually a person suffers from alopecia, which is hair loss. They have nausea and vomiting, mucositis, open sores in their mucous membranes. Uh, Sometimes they'll have altered bowel elimination, changes in cognitive function. And what they usually do is they treat these side effects as they go along, depending on how severe they are or whatever they have to do. They just kind of treat them. Um, accordingly. Hormonal manipulation is another treatment for uh, cancer patients. I'm not like real familiar with it, but some hormones make hormone sensitive tumors uh, grow a lot more rapidly, and so as a result, what you they use hormone manipulation uh, as as a way to treat cancer producing cells or sensitive, like if they're sensitive to a particular hormone, to decrease the amount of growth. So that's what they basically do. I did want to. I'm gonna go back one more slides right quick, but I did want to tell you just a couple little guidelines in terms of like when a person tends to have any of these particular side effects or whatever, or treatments that could be, or things that could be considered, as a nurse, um, when they have, various signs and symptoms. Of course, if a person has the anemia, the neutropenia, thrombocytopenia, you're going to be more concerned with infection, and not necessarily the patient. What I'm saying is the patient getting infected, and that is the reason why you're going to do everything that you can do as a nurse to make sure uh, that they're safe. So, like for instance, if they say that they have thrombocytopenia, which means that they don't have any platelet account, you're gonna look for things like platelets clot. You're gonna look for bleeding, so you're gonna do what you can do to monitor them for like bleeding or that type of thing. um, if they have nausea and vomiting, of course, what you're gonna do is you're gonna give drugs that can control nausea and vomiting. And you want to make sure that you focus in on the patient being able to tolerate different foods. A lot of times they give them like Zofran and different things like that to calm them down. If they got problems with the mucositis, which means that their mucus glands and that type of things or inflamed, you're not gonna have them brushing their teeth. You're gonna use soft bristle brushes. You're gonna have them use water, just plain water, um, with just plain tap water and stuff like that. Any type of you don't want them drinking any type of alcoholic beverages or using tobacco. You don't want them to have anything in their mouth that's going to irritate them. That type of thing like that. Just as a nurse, that's the type of things that you would do. And also, uh, a lot of times when a person has changes in their cognitive function, you will think about that, and they call that chemo brain. And a lot of times they say that it's more common with women. When they have like side effects and they lose their memory and that type of thing like that as a result of them having chemotherapy. Um, Okay, I'm sorry about that. Okay, so when we was talking about hormonal manipulation, and I was saying that some tumors actually require specific hormones in order to divide. So they may do things or they may stop a certain hormone because of the fact that uh uh that because of the fact that they may stop the hormone because of the fact that that may make that particular tumor divide more. So as a result, they may stop it. Now, as a result of that, there can be specific side effects of them doing various hormone therapies, or they may use a hormone that may be an antagonist to another hormone, and that's when they start talking about like, um, for instance, they might give a man a estrogen, or they may do an androgen in a female to manipulate the cancer. So whatever, like for instance, if you're giving a woman an androgen and an anti-estrogen type receptor drug, it'll make the woman start having little masculine effects as a result of it. And for women receiving androgens, acne may develop. Hypercalcemia is also common, and liver dysfunction may occur if it's prolonged. Uh, for men, a lot of times they say that feminine manifestations often appear in men who take estrogens or progestins or and they'll end up with like a gynecomastia, and that's where they'll develop, breasts. The next type of therapy that you would do is a photodynamic therapy, and basically that's selective destruction of cancer cells through a chemical reaction triggered by different types of laser light. So the main thing that you would tell a patient getting this is that the to prevent complications and everything, the patient is usually going to have some type of sensitivity to light for up to 12 weeks. And so basically, the main thing that you want to talk to the patient about is eye protection and clothing and gloves and preventing burns and and that type of thing. So you're more concerned a whole lot with the sensitivity as far as their skin when a person is getting photo dynamic therapy. Also, the next one would be the gene therapy, which they say that's a cancer treat experimental, and it renders the tumor cell more susceptible to damage or death by other treatments. And they actually inject into the tumor cells, enabling the immune system to better recognize cancer cells as foreign and kill them. And they say it's a HLA, human leukocyte antigen, and cytokine. So they're going right into um, the cancer cells so that the body will be like, what is that? You know, that doesn't belong there. So, um, oncologic emergencies. Some of the emergencies would be one, sepsis and disseminated intravascular coagulation. Um, Basically, what you would do is the prevention. Uh, you don't want to and IV antibiotic therapy for the sepsis, anticoagulants, and stuff like that if they have problems with their coagulation as a result. That's the type of therapy that you would do. So, with that sepsis and disseminated intravascular coagulation, um, the organisms basically they enter the bloodstream and they can cause the patient to have septic shock. Patients with cancer are at risk for infection and sepsis are at a real great risk. Um, so, basically, when you're treating the patient, you're doing everything really quick. As far as like I was telling you, the management for it is the antibiotic therapy, and you're catching everything very early. Anticoagulants, especially like heparin, are given to limit clotting, and they prevent the rapid consumption of circulating clotting factors. So you're gonna treat it like that. Syndrome of inappropriate anti diuretic hormone, where the water is reabsorbed to excess by the kidney and put into the system circulation. It's most commonly found in carcinoma of the lung. And basically, we've talked about that before. Uh, and you're going to treat the condition and the cause. The nursing priorities would be patient safety, which would be preventing fluid overload from becoming worse, because otherwise you can that'll lead to pulmonary edema and heart failure. Um, you're going to restore normal fluid balance, and you're going to provide supportive care. Another thing that could could happen as a result is increased calcium levels, because most often in patients with bone metastasis, when they have cancer in the bone, that causes release of calcium in the bloodstream. And so some cancers like lung, head, and neck, kidney, or lymph nodes, they secrete the parathyroid hormone, and it causes bone to release calcium. And as a result of it of releasing the calcium in the bloodstream, the person will be fatigued. They'll have loss of appetite, nausea, and vomiting, constipation. They'll start urinating a lot. You want to do an ECG, and make sure that there's not changes and stuff. And basically, what you're gonna do is you're gonna treat it. You're gonna hydrate them. You can give them oral glucocorticoids and calcitonin. And usually, when a cancer-induced hypercalcemia, a person, it can be kind of life-threatening, because especially if it occurs when a person has like kidney disease or dialysis, and that can reduce a little bit of the calcium levels. They might even take a person and put them on dialysis like right away, um, and they might, pull off and dialysize them until they get them over the hump. Superior vena cava syndrome is compressed or obstructed by tumor growth condition and can lead to a painful, life-threatening emergency. Signs include edema of face, Stokes sign, edema of arms and hands, dyspnea, erythema, and epistaxis. So, basically a bloody nose. Um, Basically the manifest what the reason why that happens is that they have blockage of the venous return from the head, neck, and upper trunk, and a lot of times people uh uh like they'll be asleep and they'll get up and they'll still have edema in their face and stuff even after sleeping. And the main thing that they have to do is it's really happens because a lot of times what happens is a person has um, high dose radiation, and this will happen because the cancer is usually like really have spread a lot. And what they usually do is put a metal stent in the vena cava and an interventional radiation department to like relieve the swelling, and then they follow up with an angioplasty. Okay, and that's basically the only real thing that the person can do for that. And then tumor lysis syndrome, there's a large number of tumor cells are destroyed rapidly, resulting in intracellular contents being released into the bloodstream faster than the body can eliminate them. And basically, what you need to do is prevent this by hydration and drug therapy. Um, uh, they need to Patients need to drink at least 3,000 milliliters of water. They really want you to do more, like 5,000 milliliters after treatment. Fluids should be alkaline, like sodium bicarb, to help prevent uric acid precipitation, and they stress the importance of keeping fluid intake consistent throughout the 24-hour day, and or while a person is getting any type of treatment at that particular time. And so that's basically it. Um, what I'm going to do for you guys is I'm going to just give you a little bit of a few questions on cancer, and I'll make sure that I focus in on what type of things that I really truly truly want you to know. Have yourself a good evening. Thanks.